Hi, my name is Selam Aklilu. I'm a chiropractor and a medical doctor practicing in Ethiopia. I moved to Ethiopia after practicing in California for 14 years. I went to school in Los Angeles, Cleveland Chiropractic College, then to Xochicalco Medical School in Ensenada, Baja California. And I've been in practice 24 years. And as I said, since I've been a chiropractor first, by the way, a chiropractor is always a chiropractor because that works. If you want to heal somebody, start from there. And I'm running a clinic called First Chiropractic. I happen to be the first chiropractor in Ethiopia for 80 million people, but the reason I called my office First Chiropractic is because to really, truly believe that first, try chiropractic, then try medicine, third, you try surgery. When I first came out to Ethiopia to practice chiropractic, the usual challenges that are in North America was in the back of my mind. And that was the reason that I became a medical doctor. So I would say, you know what, if anybody wants to challenge the efficacy of chiropractic, I can sit down and challenge it in each way. So the good thing is I didn't have that challenge a lot. It took a while to really prove what chiropractic is and what it can do in the country. One experience I would like to share maybe was the first year I started my practice in Addis. I had a young man, I think about 25 years old, was highly educated, and he had a disc prolapse and he was not able to walk. And they carried him in my office because somebody told him from America that there was a chiropractor in Ethiopia. And when they brought him, he came in with the suggestion that he was supposed to have the surgery the next day. If he didn't, he will be in trouble. And here I am trying to tell or convince his family, saying that he doesn't need surgery. Why don't you give me some time? Give me a week and let me try it. But at the same time, it was scary. And nobody heard of chiropractic. Nobody knows. And the next day, the rumor I heard is there's this crazy lady that says a person doesn't need surgery with an L4, L5 major disc protrusion and prolapse. And it took about 3 days of care, and that young man was able to walk out of my office. So that was my first proof. So a couple of the neurosurgeons heard about it, and they were wondering, and most of the doctors start referring their patients. Actually, not their patients, their relatives. To tell you the truth, the first neurosurgeon who sent me his relative, I said, wow, that was nice. And now almost everybody refers, and they know if they want to care and their concern is to get the patient well. For any major spinal problems, mechanical spinal problems, nobody would suggest surgery unless they try and really exhaust it. Start with, when you know that you're here to really serve the patient, your purpose or your interest is really to get the patient well, that takes that puzzle out, what we have in North America. That challenge of, I think I would define it as being, I'm sorry to say this, but if there is a word as such, the medical economics or politics is what is really creating that. And in Ethiopia, not most of the medical doctors do have any shares in the pharmaceutical companies. Personally, I don't think they do care. As long as, and they're really, they're really in awe to say, oh, this thing works. And I have surgeons as a patient. I have all kinds of doctors as a patient themselves. Yeah, and they see it works. So, and I'm hoping this would continue. And chiropractic in true sense of serving the patient. And if we do that, I think, we are the right and left hand. We can wash better, and we can really serve the people we're serving better if we combine chiropractic and medicine, because both these have places, and chiropractic should be started first in the patient care, and most of the mechanical problems, that should be first, before medicine, before surgery.